Welcome back. Yes, we just, in that space, Ini was talking all the money, and she didn't really talk taxes, the tax reform.
She mentioned
that she just teased it and then moved away and started talking about what we're talking about, the petroleum industry. That is one matter that every Nigerian tends to talk about. Practically, you cannot have a conversation with a Nigerian in the last 1-2 years and he'll not tell you how much is petrol, how much is gas, how much is electricity. Are you on band A or band B? But our conversation at this point in time is not just about petrol. Let's talk about things that will help you get petrol, because you need to be healthy for you to be able to get petrol or buy the electricity. And to look at the health sector, currently the ministry and the coordinating Minister of Health and his team, they're doing like a review of what they've done in the last 1 year or thereabout. Has there been positives? Have there been positives? Are there takeaways? Are there things that we should be looking forward to? These are some of the conversations we'll be having today. And we have here in the studio Dr. Muntaka Umar Sadiq, who's the National Coordinator of the Sector-Wide Approach Program. It's a Federal Ministry of Health and Social Welfare Initiative. Thank you for joining us this morning.
Thank you very much for having me.
So, Dr. Umar Sadiq, 1 year down the line, what would you say if I ask you, would you say there's been an improvement in access to health for Nigerians if we look at, say, let's just say approximately 200 million Nigerians and health? How would you put it? Would you say there's been an improvement in the access to health for Nigerians?
Well, thank you very much for having me. I think first there's a context to this, and I will in fact answer your question, because nearly a year ago, December last year, Mr. President unveiled our Nigeria Health and Renewal Investment Initiative. So I wanted to just give some context and make everyone understand what we signed up for, what the expectations are. Because at the heart of Mr. President's Renewed Hope agenda really is the well-being and health of Nigerians, right? Mr. President has really spoken to the fact that the health sector is the basis for accumulating our human capital, essentially what you're speaking about. So unlocking both the full potential of our people as well as the full potential of our economy. So this really provides the backdrop for the commitments that he has really shown in the health sector, increasing the budgetary allocations, his personal time in being the AU champion for human resource for health. And I think this goodwill is what the Coordinating Minister of Health and Social Welfare has really drawn from to articulate this vision to save lives, reduce financial and physical pain, and to produce health, and to do so for all Nigerians. So to your questions around access, absolutely, our aspiration is around universal health coverage. But the business of advancing reforms within the context of 240 million Nigerians take time. But today, rather than talking about what we signed up to last year, we're here with our scorecard. So I'll be talking numbers with you, and we're really excited about this.
I was actually hoping that you start out with the numbers, then go to...
No, because I think that the context is quite important.
Yeah.
And let me say this, because achieving this bold transformation requires our collective understanding of the hows. And there are 4 important hows. The Coordinating Minister has outlined 1, prioritizing building effective governance, right? And that means working with states and local governments around fostering accountability and responding to the yearnings and expectations of Nigerians. And earlier we spoke about the Citizens' Voices survey. That's essentially why we did that. But the second important pillar is strengthening our health systems to improve population health outcomes. You asked about access. I'll be talking about how we have improved not just the revitalization of our primary healthcare systems, but maternal and child health conditions, basic services, malaria, infectious diseases, but also how that has been complemented by some of the work from the health insurance, because there's a nexus between the supply and demand side to meet the yearnings of Nigeria. The third is the fact that if you recall what happened during COVID, the vulnerability of our health system is such that we need to ensure that we unlock the value chain so that we enhance our local manufacturing, take the health sector from being an economic drag to one that is a net contributor of economic growth. So local manufacturing, so that we're not depending on anyone when it comes to our basic commodities and supplies. And the fourth is really around health security. And we've had some progress around each of these paradigms. And there are 4 ways to report back these expectations. One is around outcomes, because in our world, the currency for health sector performance is how many lives saved, right? So we want to talk about some of the outcomes. And there we have seen from this report, which coincides with the 2023 demographic and health survey, 42,000 households, so very rigorous sampling. So I'm not talking about me, it's third-party verification. We've complemented this by a Citizens' Voices survey, 2,600 Nigerians across the country to understand their perceptions. And so when I say that in terms of outcomes, we are down 17% in terms of under 5 mortality. We have done quite well, actually, in terms of infectious diseases. Diarrheal diseases, down 40%. TB, 24%. HIV, 12%. Malaria, quite marginal, 5%. But also, in terms of routine immunization, slightly up, but we're not happy with where we are in terms of what we call zero-dose immunization, a bit down. We see that we're also struggling when it comes to the affordability of care. Yeah. Some of what you said around the inflationary and FX pressures is also hitting us in the health sector. The costs of our medical commodities and drugs is really hitting in terms of financial protection. But we've also seen that the Health Insurance Agency has responded because we are now up 14% from last year, right? We've gone from 16.7 million Nigerians having health insurance to 19.1. And this is third party that can be verified. This is in terms of outcomes. The second is the fact that we have a swap compact, a compact where Mr. President, all 36+1 governors, as well as 17 development partners signed up to a few expectations, a joint accountability framework, if you like, quarterly dialogues with our states, the amount of commitment in terms of the financing for health. And there we can report back that out of the 40 core indicators that we signed up to in terms of our presidential bond, 31 have been exceeded by Q3 this year. We hope that by the end of the year, we would have done better.
These successes you're reeling out are just between December and now?
So these successes I'm reeling out are 2 time periods. One is for the last 12 months, right? So the things around the perception surveys from Nigerians is 1 year. The NHI, the health insurance, we're talking 1 year. But there are others that require, household surveys of 42,000. That was from 2018 to the end of 2023.
So I want us to be able to focus on the unveiling, because that happened in December last year.
Correct.
And that's what you're basically honing in on, the Health Sector Renewal Investment Initiative through a sector-wide approach. I want to be able to look at the successes that you've recorded between December and, because almost a year, it'll be a year next month, the successes and the challenges that have been faced in this initiative that was unveiled by the president.
Okay. So what we unveiled by the president is a combination of a few things. It is a new paradigm of doing business, so expectations as to our interface with states. We've had quarterly dialogues with states. We agreed on having states have annual operating plans that reflect our government's priorities. All states have done that. We agreed to revitalize some primary healthcare centers. Our aspiration is to go from 8,800 to 17,000. We found in our survey that lower than 1/3 of these facilities are functional. So the National Primary Healthcare Development Agency has worked to revitalize those facilities. And I'll give you the numbers. So far in the last 1 year, 239 facilities have been renovated.
Okay.
319 are work in progress currently. As you know, the remit of primary healthcare is local governments and states. The NPHCD has worked with states to take on 2,600 facilities. And under the sector-wide approach, through our partnerships and pooling resources for several other partners, we are targeting an additional 2,000 facilities over the next 3 years. These are real facilities that over the next few days, we are inviting CSOs, states to verify, to ensure that we are on that path to accelerate improvement in health outcomes.
Working with stakeholders, especially because you're heading the sector-wide approach, which means that you have to deal with subnationals. You also have to deal with a lot of stakeholders. What sort of collaborations have you made on that level, and what challenges do you face in getting more of the results that are expected of you?
The sector-wide approach, which we call SWAP, really responds to the structural and systemic challenges that we have seen in the health sector for decades. And that's everything from inadequate and inequitable financing to our data issues, but also, and more importantly, the poor governance. And so the hyperfragmentation, the poor coordination between federal, states, and in fact, the lack of accountability structure to define the expectations and the rules of engagement between federal and states. And so when I say that we have had all governors sign a code of conduct, sign core indicators, sign a compact, I believe it's the first time where we're being very clear with states that we're going to meet quarterly and look at your results. Look at where you are in terms of maternal, neonatal, and child health interventions, where you are in terms of the revitalization of your facilities, and undertake a performance management systems so that we are all rowing in the same direction. The coordinating minister calls it our North Star. And so that's how that has worked. But in addition, the sector-wide approach really is around improving governance, converging resources, because we have, on the one hand, outlined our priorities. We want to make sure that the funding of states and development partners align with these priorities. And so some of the work that we have done is to identify the local governments. There are about 172 local governments, so we've gone beyond states, to understand where 50% of our maternal deaths come from. They're just 172 local governments. And we, over the next few days, will be...
50% of our maternal deaths come from 172 local governments.
Correct.
That's what you've discovered.
Yes.
The bulk of the locations of the local governments were...
They are actually interspersed. So it is roughly 19 states.
Okay.
But at least this subnational targeting means that over the next few days during the joint annual review, we will be announcing what we call the MAMI initiative, right? So that we are localizing the issues, we are responding with both the demand side issues, and we have seen that much of the issues are actually around education, child spacing, some that have nothing to do with the health sector. And in fact, we're partly pleased that the Minister of State for Health and Social Welfare is now our new Minister of Education. And so we hope to work closely together to ensure some of the demand side barriers in terms of education, but also the coverage issues and the quality of our skilled birth attendants are covered as part of this initiative, in addition to innovative tools and commodities to crash down maternal mortality.
Nelta, you know, there's a report they say they're coming up with at the end of the week, and it's called the State of the Nigerian...
Report. State of the Health of Nigerians
State of the Health of Nigerians report. What does that mean, really? And what, since the report is going to be launched during the week, what's its content? And I want to hear the name again, the State of the Health of the Nigerian report.
Yes, it is called the State of the Health of Nigerians report. And
when
just
you
to
say
say,
the state of health, is it my mental health, my physical health, with everything I'm going through? What does that mean, really?
Okay. So I mentioned earlier that for us, what we're solving for is not just about saving lives, it's about reducing the physical, financial pain, including the mental pain that Nigerians go through. And I wanted to add too, that the name of this report, as laborious as it sounds, the State of Health of Nigerians report, comes from our law. It comes from the National Health Act. Right? And this is the first time that we're implementing this law to the letter. And so the 40 indicators that we are reporting against over the next few weeks includes everything from infectious diseases, non-communicable diseases, as well as other important outputs. And in fact, the code of conduct, the behaviors that we expect of states and our development partners. And I've mentioned that in addition to this independent survey that was done, we have gone around to get the perspectives of Nigerians. And they're telling us that apart from affordability, other things like health system performance was quite positive. Utilization was up. The expectations around the quality of service has actually improved from last year. Particularly, the capacity of the government to respond to epidemics was up roughly 17% in terms of their expectation. We know that there's a lot more to be done. We're not happy with where we are in terms of stunting, in terms of aspect of routine immunization, and at least there's clarity as to what we're going to focus on over the next few years.
I mean, the conversation around stunting came up in the past week, so to speak, because of a lot of things that were going on in the country. And just so people can understand what stunting really means and the places that are highly affected by stunting and the impact it's having on the populations of those areas. Maybe you could share a little bit of your experience with us dealing with people who are suffering from stunting.
So I think we need to also acknowledge that there are social determinants to health sector performance. There are certain things that come from the interplay between what we do within the health sector and the facilities And there are a few things where things like the quality of our nutritional intakes. So what happens in terms of food security as well. But we know too that malnutrition, roughly 2 out of 5 Nigerians really have issues with malnutrition, and it's one of the biggest causes of death. And so we're really prioritizing this. It has an impact in terms of cerebral agility, educational attainment, productivity. And so the lives of our children, particularly in terms of all the complement of tools that they need, whether it is wasting or stunting, I think is a priority that we'll be discussing over the next few days. But I have to say that already there are interventions through our partners in World Bank and the ministry itself deploying more resources at the front lines to ensure that we increase and address some of these stunting challenges.
I want to be able to take a look at the rollout of the malaria vaccine. Of course, we saw that it's supposed to start off with Kebbi and Bayelsa, and then it's also going to be just for children. Talk to us a bit about, you know, your office and what kind of collaborations you're doing to ensure that these malaria vaccinations reach. And we hear there's going to be more. More states are going to be involved by next year. So just what kind of collaborations are we looking at, and what challenges do you envisage?
Sure. Thank you very much for that question. I think from where I sit in the sector-wide coordination office, we walk through what we call a collective leadership, a network governance. So we work very closely with our brother and sister agencies, the National Primary Health Care Development Agency, and this is squarely, down their remit. But I want to speak a bit about it because I think it's quite topical right now. This report shows that there are marginal gains over the last few years, 5%, right, in terms of reduction of malaria, but in terms of ACTs, the treatment for it, also slightly up in terms of coverage. I say this because we see the R21 vaccine, and in fact there are 2 different vaccines, as a complement, one of a number of tools in our quiver to address our efforts to go from malaria control to malaria elimination, right? And so it may be that there are some states where the archetype of interventions will be a combination of case management, seasonal chemoprophylaxis, treated bed nets, and there are some states that vaccines, and for now we're talking 5 to 11 months, and it's not just one, it's a number. So there are lots of learnings. We need to build the capacity of our healthcare workers, right? We need to ensure that we learn how does this work in different topographies, in different vector etiologies as well. And so that is why we are focusing on states like Kebbi, huge disease burden, as well as Bayelsa, to learn before scaling up, because we think that this effort also has important paradigms around the cost, right? The important trade-offs. So we want to understand how will this work within all of the other options, and where does it make sense to scale that up? We're incredibly excited about having, for the first time, the ability to roll out such a vaccine in Nigeria. And I think I have to commend the Coordinating Minister of Health and Social Welfare to ensure that Nigeria is one of those countries that can test out the rollout of this initiative. But I know that my colleague, the ED of NPHCDA, is working with all of the stakeholders at the front line to ramp up the awareness and educate the people more in this direction.
There are 2 things that bother Nigerians a great deal: health and economy. And these are things Nigerians who want to get a lot of information about. You've reeled out some good successes here. One of the things that really, for me, it's about that 172 LGAs in 19 states, about 50% of. So that means we can say, okay, there's a target. We're headed somewhere. When we're done with this, we can now spread our nets to other areas of things, which is good. But you said something just now about capacity of our health workers. I don't know if there are any successes that have come from that angle, because I know that in the course of having conversations in the last 1 year, the ministry had talked about the capacity of the health workers in Nigeria. Also coupled with the fact that there are those who are the Japa syndrome. But then we also know that there are those who are coming out. So that area of capacity of the health personnel, what are we doing in that aspect?
In fact, that is another area that we have some gains to report in as well. And I'll tell you why. Across all the different levels, from Mr. President, who has invested personal time to be the African Union champion on human resource for health and community healthcare workers, he has given the directives to ensure that we train 120,000 frontline health workers over the course of his administration. That has now been done. We're at 43,000 today. So everything that we're discussing integrated case management.
Break it down. So train 120,000. You know, in the Nigerian universities, for instance. Hold on.
No, I'm with you.
So you break it. That's why I say break it down.
Yes.
We know that every year we have doctors, pharmacists, and all that graduating from the universities. So is it that kind of training, or this is specialized training for those who have already graduated and are working?
Thank you for the opportunity to clarify that. We are talking about retraining frontline health workers that are already in states working in facilities. We're solving for improving the quality of care that is delivered.
Okay.
Over the last decade, as you know, the tools and standards of care has been upgraded. What it means to treat malaria now in an integrated fashion, or epidemic responses, has moved. So we want to make sure that our frontline health workers are capacitated to do that. And in fact, that's why in our citizens' voices, we're seeing Nigerians reflect that sentiment. So out of 120,000 frontline health workers, and we're talking community healthcare workers, midwives, right, at the front lines, 43,000 have been trained so far. So we're absolutely on course to do that, to hit that target of 120,000. And the ED of Nigeria Primary Healthcare Development Agency has been, in fact, talking about this. But you mentioned the pre-service training, so I wanted to talk a bit about that. The Coordinating Minister of Health and Social Welfare has, for the first time, doubled the quota. We recognize that is an opportunity to ramp up production, right? If most of our workers, as you alluded to, go out of the country, Japa syndrome, that means there's something that is positive happening in our schools, right? They're able to equip our medical students in a manner that they see value for them. So our response to that, through our managed migration policy, is what we call, diplomatic managed migration, such that we are ramping up the production so that even if some go out, there'll be enough available to do this. And I know over the last year, 2,500 doctors have been recruited. Doctors, nurses have been recruited to ensure that some of those priority local governments that we have identified have the complement of both human resource as well as equipment, innovative tools to deliver quality services that we think will help us crash maternal and neonatal mortality.
I do know that in the last 1 year, the cases or news of threats of strike actions have been focused more on security issues, not necessarily remuneration as much as that. So is that an area that this initiative is also looking into to ensure that the medical personnel, the doctors, the nurses, the midwives, all the personnel there are not seeking to go on strike because of remuneration or welfare, but issues of security? And will that also be addressed in all of this?
So the sector-wide approach, where I sit, we focus on what we call one plan, one budget, one report, and one conversation. However, we work very closely. In fact, we are institutionalized in the Federal Ministry of Health, so the directors, the departments of hospital services, and some of the leaders that are responsible for ensuring that the welfare and safety of our health workers, both in terms of remuneration, but more importantly, in terms of the incentives and the tools they need to deliver services. But I also wanted to use this opportunity to talk about all of the important actors, both NHIA, NCDC, MPCDA, that have worked collectively to ensure, and obviously with the guidance of Mr. President, that some of the yearnings of our health workers are kind of being met. And I know the Coordinating Minister will speak a bit more about some of that, all encompassed within our managed migration policy also going forward.
I mean, there's a joint annual review that's holding later this week. So talk to us a little bit, I think it's from the 6th to the 8th of this month. So what are your expected outcomes for this joint annual review?
So there are a few things that we want to do. I think we see the joint annual review as our basis for having one conversation in the health sector. We want to have a conversation where we're looking at one source of truth, because there's always the risk of having different data sources and framing our progress in multidimensional ways. So we want to have one source of truth so that we're being honest with ourselves about our performance, and we have a shared judgment around the impact that we have had, the lessons, and more importantly, how to respond. And so there are three things that we're looking for on the back of our joint annual review. The first is to review the state of the health of Nigerians report. We want to invite everyone to look at these numbers, verify it, tell us where we've gone wrong, help us build a coherent response to what we're doing. So I think that's one, reviewing our progress. The second is ensuring that we mobilize partnership to address the data issues that we're now seeing. So we're going to be calling on our partners so that these kinds of reports, rather than having it every 3 years, that we have it every single year, so that we solve our data problems once and for all. And the third thing is that given the issues or the areas where we know that we are struggling, the response to it, this MAMI initiative, where we are prioritizing certain local governments and mobilizing resources of our partners and states so that we focus on the areas that have the biggest need and crash maternal and neonatal mortality drastically over the next few years. So I think that's why we're having this conversation. And I think a final piece is that we see the impact of climate in the health sector, and we will be launching a vulnerability assessment report during the joint annual review as well. I believe that we have actually the largest climate intervention initiative in health over the next year, and we're excited about that.
Climate seems to affect everything. Thank you so much, Dr. Muntaka Umar Sadiq. Thank you for coming in this morning.
Thank you very much for having me.
We wish you well during the review, and we hope at the end of the day, Nigeria's health indices will be high up there and in every area, as we say, sector-wide.
Thank you so
again. Dr. Muntaka Umar Sadiq is the National Coordinator of the Sector-Wide Approach Program at the Federal Ministry of Health and Social Welfare. And just before we
have a few messages, I think.
Yes,
we have 2 messages. And I want to apologize for yesterday. We didn't take their messages yesterday. Apologies for not taking your messages yesterday, but we will get to your messages today. Festus Akimboyewa says, Nigeria must win the race for energy security in the country. We must be happy and proud that we have local refineries like Dangote refinery when refineries are closing down across the world. Nigeria must patronize and support local refineries. The federal government must not allocate our scarce dollars for the importation of PMS.
Okay, that's from Professor Kimura. Professor Imonuka Inahina says the ongoing impasse between Dangote Refinery Management and NNPCL must be fixed so that Nigerians can face the long, arduous task of rebuilding its petroleum sector and maintaining a moderation of its prices. There's shenanigans and political undertone in what's now bedeviling an institution whose working operations is shrouded in secrecy. If this sector bases its prices of petroleum products on the prices of crude on the international turf, then we're in for a long, rough ride. Professor Inakena there.
And before we wrap up, just so you can get on with some of the breaking news that we have for you right now, the Attorney General of the Federation, of course, represented by the Director of Public Prosecution of the Federation, had announced, the exercise of his power of Section 174 of the 1999 Constitution to take over the case. Of course, we are referring to the protesters who were arraigned recently. So, of course, like we said earlier, the accused persons are not in court, and the judge has ordered their immediate release from prison. In fact, we are seeing here an update where the children, and that's what they're being referred to, are being moved to the Women Development Center, where they're going to be addressed by the Minister of Humanitarian Affairs. And we've been told that the media are not going to be covering that, but just so you can have that update there for you.
And that's all we have to sign out for today. Thank you for letting us be a part of your morning. Remember that where you are is a good place to start doing your own bit. Don't throw in the towel yet. Thank you for watching. I'm Neota Igbe.
I'm Kayla Megwa. Have a wonderful rest of your day.